Everyone, I'm Bridget McHenry with the White Ribbon Alliance, and I'm very happy you could join us today. What I'm going to do today is talk to you a little bit about how USAID support through the Health Policy Initiative has really helped the White Ribbon Alliance to grow into a global movement. The White Ribbon Alliance is an international coalition of individuals and organizations that work to increase governance and public awareness and action to save the lives of pregnant women and newborns around the world. Before I go into more about the White Ribbon Alliance, I see that we have a number of our members here today. If you are a member of the White Ribbon Alliance, would you just please stand for a minute? Thank you. For the rest of you, I really invite you to join us and be a part of this alliance. The White Ribbon Alliance was formed in 1999. And USAID support through other policy initiatives and through the health policy initiative has really been critical to sustain us along the way. Because the White Ribbon Alliance is really about the voices of our members, I'm going to now take everyone to Tanzania, where Rose Malay will tell you more about our work.
The White Ribbon Alliance has a mission to catalyze for action to stop these deaths. We want leaders, we want even the women themselves, the communities everywhere worldwide to know that these deaths should never have happened. They should do something about it. For example, advocating worldwide, mobilizing, prioritizing for each woman to be attended by skilled health personnel, because that is one of the proven strategies to reduce or to avoid maternal and newborn deaths.
Our work focuses around three key strategies or approaches. The first one being mobilization, in terms of mobilizing action and support for community initiatives, for health system strengthening, and for the provision of quality services for maternal health, for safe motherhood. The second is commitment, in terms of increasing government, donor, and other stakeholder commitment to an investment in the reduction of maternal and newborn morbidity and mortality. And then thirdly, accountability, in terms of holding them actually accountable for those commitments. The WRA works by amplifying the voices of those most impacted by maternal mortality, enabling country and community-led and owned advocacy and accountability initiatives, working through transparent and participatory decision-making processes, and unifying the members from around the world with a common vision. All WRA members have a part to play in this movement, and the role of the Global Secretariat and of our national alliances is to really help the members see what role they have to play, recognizing that the different members are all going to play different roles, and each of those contributions is valid. The WRA members participate in our collaborative planning. They collectively identify the policy priorities in their own countries and communities, and they engage at the various different levels in terms of implementation of our campaigns and actions. Over the period of the Health Policy Initiative, the White Ribbon Alliance has grown tenfold. From, in 2006, when the program began, 1,600 members to 16,000 members today, representing 150 countries and 15 national alliances. In terms of the support through Health Policy Initiative, it's enabled the formation of new national alliances for provision of capacity building or advocacy training and planning to every single one of the national alliances, and allowed them to leverage funds from the members and from other donors to sustain their advocacy and accountability work. In specific, this has also included South-to-South TA, which is jargon for having our national alliances and members learn from one another, the dissemination of best practices, and replication of those successful strategies. But probably more than anything that's been critical is USAID's support in particular support through the Health Policy Initiative, has often been the only funding the Alliance had, and therefore sustained the Global Secretariat and allowed us to keep the Alliance afloat and continue to leverage funds. In terms of some of the results we've been able to achieve, there's work that's been around advocating for policy commitment. For example, having all of the members of the AU recommit to the Abuja Declaration, committing 15% of national budgets to the health sector, representing civil society in government planning, such as the roadmaps for accelerating the reduction of maternal mortality and morbidity, such as the one that was recently launched in Kenya, targeted advocacy around specific issues such as the child marriage laws in Yemen, preventing, not enforcing child marriage, and two innovative approaches that I'm going to talk a little bit more about. One resulting in a new policy in Tanzania increasing the number of skilled birth attendants, and the other focusing on the implementation of an existing policy in India about the entitlements due to women who deliver at facilities. So I want to talk to you a bit more about Tanzania and an approach they took there about filmmaking for advocacy. In 2007, the White Ribbon Alliance Tanzania engaged in a participatory filmmaking process that was focused to highlight the challenges faced by maternal health service providers and then also in terms of community members seeking this service. This film was actually made by 5 midwives and a doctor who before that had never even held a video camera, let alone having any experience in filmmaking or in journalism. And I'm going to share a short clip from that film with you now.
Kwa kweli hapa katika hii postnatal room kuna upungufu wa wafanyakazi. Kwa sababu mpaka sasa hivi na mastafu 8 tu. Manesi officer 2, manesi midwife 4 na nesi assistant 1. Lakini kwa siku kwa masaa 24 napokea wazazi kuanzia 35 mpaka 60. Na kila shifti, mfano shifti ya asubuhi. Mfano wagonjwa wa operation wanaweza wakaingia 3, nesi akawa 1. Na huku bado wamama ambao wanazaa kawaida wanaingia kama 35 40. Lakini nesi anashindwa kufanya kazi sehemu zote kwa wagonjwa wa operation na wagonjwa huku. Kwa hiyo inatuia vigumu sana kutosheleza katika mahitaji yetu ya kufanya kazi katika shift ambayo umeingia. Vyumba ni vidogo, vitanda tunavyo 10, lakini wazazi tunapokea kuanzia 35 mpaka 60. Na kitanda kimoja wanalala wazazi 3 ili kwamba kukava ule wingi wa wazazi.
So this film then became part of an advocacy campaign, coupled with a survey that the members in Tanzania carried out documenting in each of the facilities around the country what providers were actually there in terms of hired and in terms of actually providing services. That was shown on national television. It was screened around the country in terms of community and village screenings and was eventually shown to the president of Tanzania, who, after seeing this, was compelled to take action and issued a decree to the Ministry of Public Health and Social Welfare in Tanzania that they should immediately employ and deploy all graduating skilled birth attendants in the country to areas where there are critical shortages. And before this, there had been a hiring freeze, so this was a huge change. Now WRA Tanzania is there to ensure and monitor that the policy is being implemented. But due to the huge success of this, a number of other national alliances have either used this film or have replicated it and made their own film based on the policy priorities set within their own countries and alliances. The other approach I want to tell you about is Social Watch, which is a people-centered strategy that's about government fulfilling commitments, recognizing that women have a right to quality health care. And what this approach is about recognizing that while policy change is a really critical step, it's also necessary to take action to ensure that these policy changes result in real change for community members. Social Watch is done in 3 approaches: gathering information, then spreading awareness, and then speaking out. So starting by making sure that the community knows information and understands what the real situation is, that has been disseminated so that more people become involved in the campaign, and then speaking out and actually demanding change from decision makers. I'm going to let Aprajita Gogoi in India tell you a bit more about that.
We collect women, 1,000 women or 2,000 women. We bring them to a public meeting and we ask the local member of parliament, the administrative bosses and the medical officers to be there. And we give an opportunity to the women to talk to the powers directly. We have wonderful policies on paper which says that a woman should be given nutritious food. I mean, the government pays for it. That she should give birth in a hospital. And again, the government pays you today if you come to the hospital and give birth. The problem is, who is telling this to the woman in her house?
So thanks to the USAID and the Health Policy Initiative, this alliance continues to grow and gain momentum. We still have work to do, but someday we hope that we won't need a white ribbon alliance. Thank you very much.